Good morning. My name is David Bourdet, and I am a Vice President and Team Leader for the Ampreloxetine program at Theravance BioPharma. It is my pleasure to present the Cypress trial, a new clinical trial that our company has initiated to study an investigational drug known as Ampreloxetine for the treatment of neurogenic orthostatic hypotension in participants with multiple system atrophy. The Cypress trial is a global clinical trial that Theravance is currently enrolling for participants with MSA. The phase 3 trial will last for 20 weeks and test whether our investigational drug, Ampreloxetine, exhibits benefit for patients that have neurogenic orthostatic hypotension and MSA. The study will also examine whether Ampreloxetine is safe and learn more about any side effects. Participants that complete the 20-week portion of the study will then be eligible for entrance into a long-term extension in which all participants will receive Ampreloxetine for 2 additional years so that we can study the long-term effects of the drug. We are excited to start this particular study, and we'll tell you more about it during our presentation today. We will be talking about neurogenic orthostatic hypotension today, and you may be wondering what that is. Hypotension is defined simply as an abnormally low blood pressure level. Orthostatic is a term that is used to denote something that results from an upright or standing posture. And neurogenic is a word that is used to indicate that the condition is caused by a problem in the nervous system. In the case of MSA, the central autonomic nervous system. So, neurogenic orthostatic hypotension is a fall in blood pressure to abnormally low levels that result from standing or being in an upright position. And it is caused by a problem in the autonomic nervous system. It is important to note that nOH is very common in multiple system atrophy. In fact, approximately 80% of MSA patients experience nOH, and it is one of the most common conditions associated with MSA. The fall in blood pressure upon standing that is characteristic of nOH will often result in a wide array of symptoms in many individuals due to a reduced perfusion of the brain with blood. A common symptom resulting from the fall in blood pressure is the feeling of dizziness, lightheadedness, or feeling like you are going to black out. You may also experience blurring of your vision, the feeling of weakness, or extreme fatigue. It may be difficult to concentrate, or you may experience pain in your neck or shoulders, often referred to as coat hanger pain. These symptoms will frequently impact the ability to conduct routine activities of daily living, especially activities that require standing or walking. For example, it may be necessary to frequently sit down or lie down and rest. Therefore, these symptoms can have a significant impact on one's quality of life, and it is important to come up with strategies of management or improvement for these symptoms. Although it is possible to employ non-pharmacological methods, including diet and food intake, to improve nOH, many individuals will remain symptomatic and ultimately require treatment with pharmacological therapies. To date, there are 2 medicines that have been approved by the US FDA for the treatment of orthostatic hypotension: droxidopa and midodrine. Droxidopa was approved for the treatment of symptomatic nOH in 2014 based upon improvements in dizziness, lightheadedness, and the feeling that you would black out in studies that were of 1 to 2 weeks in duration. The clinical effectiveness of droxidopa in longer-term studies has not yet been demonstrated. Midodrine was approved based upon the demonstration of improvements in systolic blood pressure upon standing. Both droxidopa and midodrine require relatively complex dosing patterns, with administration required up to 3 times per day. Both drugs also contain warnings for supine hypertension, meaning that the blood pressure may be elevated to abnormally high levels when lying down. Unfortunately, while these drugs are effective in some patients, there still remain a significant number of MSA patients that remain symptomatic with nOH despite these available therapies. Ampreloxetine is an inhibitor of the reuptake of a neurotransmitter called norepinephrine in the nervous system. We are studying ampreloxetine in a phase 3 trial, which is the final stage of drug development prior to submitting the drug to the FDA for approval. It is important to recognize that ampreloxetine is still being investigated and is not approved by the FDA for the treatment of nOH. The administration of ampreloxetine is convenient and is given orally as a single once-a-day tablet. Ampreloxetine has already been studied in over 800 clinical trial participants to date in various disorders, including multiple system atrophy. So how does ampreloxetine work? The top half of the slide depicts the situation in people that have neurogenic orthostatic hypotension and MSA. Under these conditions, there is insufficient norepinephrine released when a patient stands up. Therefore, upon standing, the blood pressure will fall because blood vessels do not constrict as they would following the release of normal levels of norepinephrine. Often, this drop in blood pressure will result in the symptoms of neurogenic orthostatic hypotension, including dizziness and lightheadedness, as well as other symptoms such as vision impairment, weakness, fatigue, trouble concentrating, and head and neck discomfort. Ampreloxetine functions to block the norepinephrine transporter and therefore increases the levels of norepinephrine present when you sit or stand up. The increasing level of norepinephrine should result in a relative increase in blood pressure. We hypothesize that this increase in blood pressure can also increase blood flow in the brain, which may help reduce the symptoms of neurogenic orthostatic hypotension, such as dizziness and lightheadedness. Ampreloxetine was studied in a prior clinical trial, Study 170, and demonstrated improvements in both standing blood pressure and nOH symptoms in the 40 combined MSA participants that were treated with ampreloxetine compared to a placebo pill. The benefit with respect to standing blood pressure is shown here, and those that received ampreloxetine had a systolic blood pressure upon standing that was approximately 18 millimeters of mercury higher than those that had received the placebo pill. Importantly, these benefits that were observed on blood pressure were also seen when the symptoms of nOH were evaluated. As you can see here, the benefits of ampreloxetine were observed across a constellation of symptoms of nOH that included dizziness, vision impairment, weakness, fatigue, trouble concentrating, and head and neck discomfort. The magnitude of these changes was clinically meaningful, and the effect was maintained over the length of the 22-week study. In addition to the favorable impact on symptom scores, there was also an improvement in daily activities that require walking and standing for a short time. Theravance BioPharma is now interested in confirming whether ampreloxetine is effective and safe in treating nOH symptoms in MSA patients, and to learn about any unwanted side effects. Ampreloxetine was generally well tolerated in the previous trial, with the most commonly reported adverse events being headache and urinary tract infection. The phase 3 Cypress trial has been designed to test the durability of any effect of ampreloxetine over 20 weeks in participants with MSA and neurogenic orthostatic hypotension. All participants will receive ampreloxetine for 12 weeks during an open label period, followed by randomization to either placebo or ampreloxetine in a blinded fashion during the randomized withdrawal period for an additional 8 weeks. A composite assessment of the symptoms of neurogenic orthostatic hypotension that includes these key symptoms, including dizziness, vision impairment, weakness, fatigue, trouble concentrating, and head and neck discomfort, will form the basis of the primary evaluation and results for this particular study. All the participants that complete the initial 20 weeks of the trial will also be invited to continue participating in a long-term extension and receive ampreloxetine in an open label fashion for up to an additional 2 years, so that we may learn more about the long-term safety and side effects of the investigational drug. You may be eligible to participate in the Cypress trial if you meet several key criteria, including 1, you must have been diagnosed with multiple system atrophy. 2, you have neurogenic orthostatic hypotension as demonstrated by reductions in blood pressure upon standing. These reductions in blood pressure must be greater or equal to 20 millimeters of mercury systolic, or greater than or equal to 10 millimeters of mercury diastolic upon standing. The third criteria is that you have symptoms of dizziness associated with your orthostatic hypotension. Other eligibility criteria for this study also apply, and study doctors will review your eligibility with potential participants. The Cypress trial has been designed to help minimize some of the challenges encountered during clinical trial participation. For example, to alleviate the burden of travel participation visits may be conducted in either a clinic or hospital setting or at the participant's home. You may be wondering how you can participate in the Cypress trial. We are currently enrolling at study centers across the United States and are opening centers worldwide. For more information regarding trial participation, including the locations of study centers, please email us at cypress@theravance.com. Give us a phone call at 1-650-808-3737, or visit our study website at www.cypressstudy.com. Theravance BioPharma is committed to improving the lives of MSA patients with symptomatic nOH. Please consider joining us as we take another critical step toward the goal of managing symptoms of neurogenic orthostatic hypotension for people with MSA. Thank you very much for your attention today and for your interest in clinical trial participation.